This lecture is on the ethical aspects of sonography. The information from this lecture will be used in class on October 10th. Some say that ethics begins where law ends. The basic ethical concepts pertinent to the field of sonography are the ethical treatment of patients, co-workers, employees, and a responsibility to the profession of diagnostic ultrasound. The objectives for this lecture is to establish an understanding for medical ethics, understand the sonographer's ethical expectations to patient, employer, and self. Once again, I just want to hit on patient satisfaction. This is what we work for and what it all comes down to at the end of the day. This is very important information as you begin your sonography career. Hospitals send out surveys randomly to their patients post-treatment, including outpatient diagnostic testing. Patients are asked a number of questions and they must answer on a scale of 1 to 5. There is also a space for comments. This will also affect you as students since you are part of the patient's experience, whether you scan the study or just observe. Accountability through surveys. Once again, accountability is a big part of the sonography profession. The Press Ganey surveys are scored and then are posted publicly on the internet for everyone to see. Every employee is held accountable for the scores of their department as part of their performance evaluation. I know I touched upon AIDED a few times already, but one more time, I just want to touch upon it just to show how this is just a little script that was put together to show accountability for the sonographer. AIDET, A-I-D-E-T, stands for address. Address the patient, always refer to them by their first and last name. Introduce, always introduce yourself. Make the patient aware that you are a student and ask permission to observe or scan the patient. It's always important to also include that you do have a staff sonographer who will be working along with you. It's always good to let the patient know the duration of the exam time, to explain the exam to the patient, and when you are done, to thank the patient and ask them if there's anything else that you can do for them or if they have any questions. Now, going into the ethics part of your sonography career, ethics is a system of valued behaviors and beliefs that govern proper conduct and character to ensure protection of individuals' rights. Medical ethics grew out of the patient-physician relationship. The SDMS, that's the Society of Diagnostic Medical Sonography, publishes a code of ethics and practice of standards, and you can find these on their website. On page 171, box 7-4, it's a list of the sonographer's ethical responsibilities. Most healthcare professionals are guided by the principle of kindness, good works, avoidance of harmful behavior, autonomy, justice, truth, and faithfulness to duty. The first ethical responsibility a sonographer has is communication. That's effectiveness to acquire pertinent clinical history and effective in relaying information to the patient about their procedure and what to expect. This is being able to speak to the patient to get the information from the patient to you that you're able then to translate over to the radiologist, so the radiologist has a good clinical history of the patient. And then you also need good communication to speak to the patient so the patient knows what's being done, going back to AIDET, explaining to them what kind of the procedure is going to be done, how long it's going to take. The second is compassion and respect. This is probably going to be one of the hardest responsibilities that you will have as a sonographer. Patients deserve the right to receive compassion and empathy for their physical and mental disabilities while under the care of a sonographer. And many times when you have some patients that you feel haven't taken care of themselves, and that's why they're in the situation that they're in, or they do have a physical or a mental disability that prevents them from being able to follow commands or to be able to listen to what you're saying to try to get a procedure completed. A lot of times people with mental disabilities, they can't lay long enough for you to complete the study. A lot of times they may get up and stop. And times like that, you really need to be compassionate and have a lot of empathy for those people and try to have the patience to continually reassure them that everything is okay, how much longer, back to aid it again, duration, how much longer it's going to take, and really give them the support that they need to complete the study. A third ethical responsibility of a sonographer is unbiased treatment. Each patient must be treated with equal care, with equal compassion, and with the same skill that you would use on a good patient and a bad patient, unrestricted by concerns of personal attributes or the nature of his or her disease or illness. They must be cared for without discrimination of sex, race, creed, religion, or social economic status. The fourth is personal privacy. Patients have the right to privacy in regards to their medical history. Personal history can only be shared in situations of crime, child abuse, or threats of harms to oneself. A lot of times when we are taking care of a patient, we find out a lot of information about them through their charts. And we need to remember that if it is a family member, that we never repeat that to anybody because it can get back to the patient. If you're in the cafeteria, you can't talk about a patient's personal history because you never know who's sitting next to you. You always have to be very cautious to what you're saying because you never know who is sitting next to you. Physical safety. Sonographers should be prepared and attentive to the responsibility of caring for a patient. You always need to make sure that your patient is safe, making sure that if they're getting out of a wheelchair, they can stand and move freely over to the table. If they walk with a walker, make sure that when you're taking the walker away for them to sit down on the examining table, that you're there to protect them from falling. A lot of times as people get older, as soon as they sit up, they get very dizzy. It's your responsibility to make sure that that patient isn't dizzy, they don't feel weak, and that they're able to leave the examination room. You also have a responsibility to ensure that you are a positive workplace with an environment to provide a positive impact on the patient's perception of the facility. It's important to remember that you represent the facility that you're either working for or you're observing in. Continuing education, sonographers have a duty to improve their knowledge and skills by engaging in professional activities to investigate new aspects of the practice of sonography. Sonography is always changing and there's always something new to learn. So even when you're done with your education at Misericordia, you will always need to continue learning through journals, through seminars, through societies that you can join, because things are always changing and you always need to keep up on the current practices. You have a responsibility to your employer. An employer and sonographer contract agrees upon job responsibilities in return for compensation and benefits. Both parties need to fulfill their part of the agreement. Sonographers need to be dependable in attendance, carry their fair share of workload, and to look for ways to stay productive. Even if you have downtime at work or at your clinical setting, there's always something to do. You can always refill linen, you can refill gel bottles, you can straighten up, you can assist with other departments if they need any help. There's always something that can be done. There shouldn't be any idle time while you're at clinic or while you're working. Responsibility to self. It is as important for the sonographer to consider themselves ethically in the workplace as it is to consider patients, colleagues, and employers. In addition to finding the right job, the use of proper ergonomics and body mechanics, healthy lifestyle choices, and legal protection are required to maintain a career in sonography. Responsibility to the profession. Sonographers are daily representatives of their profession. The public often bases their judgment of the entire profession on their experiences with a single sonographer. Every sonographer is an ambassador for the healthcare profession in general and the sonography profession in particular. Deontology and teleology are two different ways of looking at an outcome. Deontology is the study of duty, moral obligation, and taking the right action. Teleology is a study of the evidence of the design and purpose of nature. It's a belief that an act is right if it brings about a good outcome. Consider a patient who would go into shock if they find out about their condition. A teleological thinker would decide not to tell the patient because the outcome would not be good. A deontological thinker would inform the patient because it is his duty regardless of the outcome. Deontology rules are to be followed at all times. Go by the book, no deviations. Discourages independent thinking in various situations. Benefits and non-maleficence. All acts must be meant to attain a good result. Actions that promote safety and quality of care. The duty to prevent harm or obligation to prevent harm. To put these two into a little bit more detail, beneficence Okay, I'll try that again. Beneficence is the duty to promote good and to act in the best interest of the patients. Non-maleficence is above all do no harm. Here's another scenario. Consider a patient who is in line to get a life-saving transplant, but openly states that he does not intend to take care of himself after surgery. Beneficence. The patient will benefit from the transplant, so he is entitled to the organ. Non-maleficence. The patient should not be exposed to the risk of the surgery, since the outcome will not be positive. An ethical principle that a lot of healthcare workers struggle with is autonomy. The glossary of the book states autonomy is the right to make our own decisions, to be independent and self governing. Autonomy is the right of all persons to make a free decision without external pressures. This is indicating that a patient has the right to make decisions about themselves that they feel are the best. As a healthcare worker, you may not agree with what that patient thinks or feels, but this is where the ethical principle falls into play, is how to handle that situation. A couple examples. Does a person have a right to refuse treatment for cancer? Does a person have the right to choose holistic medicine? And does a person who practices a scientific religion have the right to refuse treatment for a very sick child? These are all scenarios that people deal with on a daily basis in the health field, and it's a touchy area. You know, who has the right to make these decisions? A lot of times, physicians feel that patients aren't really capable of making some decisions for themselves, and this is where a lot of these problems begin. Here again is another patient scenario. A 57-year-old man has been diagnosed with inoperable pancreatic cancer. His physician has explained to him the prognosis and the possibility that chemotherapy may yield a palliative effect and extend his life for a few months. In fact, the physician recommends it. After being informed of the potential and likely side effects of chemotherapy, the patient informs his physician that he declines the chemotherapy. So the dilemma, once again, is autonomy versus the physician's interpretation of beneficence. The physician wants to do the right thing for the patient regardless of the inevitable outcome, whereas the patient feels that he doesn't want to spend his last few weeks, months being sick with the side effects from chemotherapy. As a sonographer, good decisions need to be made every single day. It's I lost connection there, so I'm just going to go over this slide again. Ethical decision making. Identify the problem. Gather pertinent data and information. Identify options and solutions. Evaluate the short and long-term consequences for each solution. Make a decision. Act on that decision. Review and evaluate the results. Here's an ethical dilemma. In pregnancies that progress to term, sonographers are expected to provide clinical protection and promotion of fetal interest. These same obligations, however, do not extend to fetuses that are electively scheduled to be aborted. This is probably one of the toughest scenarios for a sonographer to be in. It's hard to not be judgmental when you're scanning a viable pregnancy and you know that that fetus will be aborted. Sonographers should not operate outside their scope of practice by attempting to dissuade, encourage, or to punish their patients. If you are unable to accept the legal medical practices regarding abortion, tell your supervisor and ask to be relieved of the duty of working with patients likely to undergo such procedures. You're always better off to ask someone else to step in whenever you're having a hard time dealing with a scenario like a pregnancy that will be terminated. Even in times when you're just having a hard time being compassionate or showing empathy for a patient, it's always better to just ask someone to step in for you before some sort of a conflict arises. Another area of ethical dilemma is the use of non-diagnostic ultrasounds. These are fetal keepsakes, they're called. They're kind of like a studio, and pregnant women go there and they're scanned by minimally trained technicians who are there for the sole purpose of taking cute pictures of a fetus, and then the clients there have the option of getting invitations for baby showers made up and pictures and baby announcements. The AIUM, SDMS, and the FDA have issued statements against the non-medical use of sonography, but that has not closed down these studios. Confidentiality. Going back again to HIPAA that we reviewed in the legal aspects of sonography. Remember, information retrieved must be on a need-to-know basis only. Computer access can always be tracked. Anytime you look into someone's chart, they know that you're looking in there. Don't look up information on anyone except for your patients. Just as a reminder, not to gossip. Respect everyone and mind your own business unless it concerns patient care. Be cautious talking about your patient's health status. You never know who's listening. And even a family friend is entitled to their own privacy. You're taking care of them to help them, not to find out their personal history. Competency. Sonographers have an ethical obligation to perform a competent examination and provide physicians and patients with accurate and reliable information. A serious breach of ethics results when sonographers lag behind in the advances made in their field by performing inaccurate, incomplete examinations or reporting the results of each examination to patients. Such sonographers seriously undermine the patient's and physician's trust. Fidelity. It's the duty to fulfill one's commitment and must keep promises both stated and implied. Don't promise something if you can't deliver it. A promise that is made to be a positive representative of your employer. Justice. All persons must be treated equally. The equality of being just, impartial, or fair. Every patient has the right to be treated the same as the next. Colleagues also deserve the right to be treated the same as the next. Veracity, the quality of being truthful or honest. Honesty in all aspects of your life, your patients, your family, coworkers, and to yourself. In this program, there is academic honesty and there's also clinical honesty. Respect for property. Just use your common sense. Take care of one's belongings. Respect their belongings, and equipment cannot be replaced often. Keep it clean and functioning properly. The sanctity of life. Belief that life is the highest good. Nobody has the right to judge another person's quality of life to the extent that it should be terminated based on personal beliefs. You are entitled to your individual thoughts regarding end-of-life actions, but you cannot impose or make decisions for others. Dehumanization. Avoid the trap of referring to patients by their anatomy. Where's that pelvic patient? Who has the abdomen? It's very easy for us to forget on a busy day when we have patients lined up out in the hallway to forget that these are people who are sick, they may be scared, and when we refer to them as, did anyone see where my pelvic patient went? The patient can hear you say that, and that just makes things worse for them. Now not only are they sick, are they scared, but now they feel like they're not being valued by the sonography department, and more importantly by the sonographer taking care of them. Academic integrity. This includes values such as avoidance of cheating or plagiarism, maintenance of academic standards, honesty and rigor in research and academic publishing. Misericordia does have a policy. Any form of cheating or dishonesty, including plagiarism, is a fundamental violation of the nature and purpose of Misericordia University. Such behavior will not be tolerated and will result in at least lowered grades, possible failure in a class, program dismissal, and in the most serious cases, dismissal from the university. The responsibility for maintaining personal integrity and honor in academic activities rest with the students. You are the only one who can make sure that you are being the best person that you can, making positive decisions, being honest, and making sure that you represent Misericordia in a positive manner. Professionalism. What is your definition of professionalism? In the textbooks, it's being involved in and worthy of the high standards of a profession. A person who does something with great skill and who meets the high standards of his or her profession. Professionalism, I think, is a wide spectrum of things. You should dress professional. You should act professional. You should respect your profession to the point that you would only perform quality ultrasounds, and that you would ensure that your diagnosis and interpretation is being portrayed to the radiologist, that accurate diagnosis on the patient will occur. In healthcare, it is based on integrity, honesty, and compassion. This is why we as sonographers must understand the patient's behaviors, the patient interaction, and the standards of conduct in addition to developing our technical knowledge and skill. Have the right balance of confidence and knowing your limitations. Improve upon your limitations daily. Ethical expectations. We don't just take images as sonographers. We are artistic, humanistic, and compassionate. Our job requires critical thinking. We must seek guidance and assistance. Don't become overconfident. You will always need to ask questions. You will always need to get some guidance, and you will always need assistance from your coworkers. The Code of Ethics can also be found on the SDMS, the Society for Diagnostic Medical Sonography, and it also lists to maintain competent certification in CMEs. A professional disclosure. If a sonographer discovers errors based on faulty equipment, technique, or interpretation, they have a duty to bring such errors to the attention of the interpreting physician. Don't ever be afraid to point out if a mistake was made. You learn more from a mistake than you will from being shown how to do something. It always seems like once you make a mistake, it sticks in your mind, and you learn at that point how to resolve that situation. When you're learning things, you learn about things, but you're not in this situation that you need to resolve it. I think that once you have that opportunity to then see the mistake and how to resolve it, you always learn to handle that situation better, and I think you become a better sonographer because you had gone through that process. In summary, the best testimonial sonographers can offer their profession is found in daily interactions that result in a patient who has been served well, has been treated fairly, and has received the sonographer's personal best. In-class activities. We will participate in activities that will make us think of ethical responsibility sonographers are faced with on a daily basis.